Hello, my name is Mehtap Today I will be analyzing the strengths and limitations of assertive communications in health and social care. Assertive communication in health and social care balances respect for others with clear, professionally advocacy for patient needs. It prevents misunderstanding and improves care quality it requires emotional regulations and cultural sensitivity to negative power dynamics effectively. The core communications modalities are verbal and non-verbal communication, listening and writing communication. In the context of health and social care, I will be discuss the strengths and limitations of these communications. I have selected assertive communication as my chosen communication style, as it is strongly related to the themes of patient safety, person-centered care, and the team working. For my part, assertive isn't a forceful attitude or manner. It's a matter of clarity, not rudeness. In health and social care, the importance of this is that silence can be unsafe. However, aggressions can have negative effects and trust. Negative thoughts. Assertiveness can be an intermediate approach that is both self-confident and caring to practice. Piplo is helpful in that her theory demonstrates that care in relational by being honest, respectful, and clear. I can use assertive communication to build that relationship. For instance, I might have to explain a care procedure to them exactly and nicely. But I'm also aware that this theory can seem idealistic when services are in demand. Organizations need to provide staff with sufficient time and training for a relationship to be developed if it's to become short-term and task-oriented. This slide demonstrates the way in which assertive communication needs to be adapted. One would not have the same tone with an older patient who is scared, an angry family member, and a colleague in emergency. It is important that assertiveness is displayed in a calm and flexible manner. Nonverbal communication is important as crossed arms, hurried movements, or a stern voice can convey a sense of unease. I would therefore want to try to match clarity with warmth. A benefit of assertive communication is that it helps professionals to speak up. A small misunderstanding can have a negative impact in health and social care. For example, on medication, safeguarding, or discharge planning. When I see a risk, assertiveness would assist me to say, I'm concerned about this, rather than remain silent. This is to ensure the patient's safety and also promotes professional accountability in other workplaces. However, assertiveness is most effective when employees are not reprimanded for their concern. That is why the assertive communications is important to person-centered care. The patient's required information to be clear. For instance, if the professional doesn't bother with challenging matters, the patient cannot make a well-informed decision. The use of assertiveness, however, should not be confused with control. I would have to tell the truth about the risk and hear the patient's values. The balance is significant because the person-centered care is not just a matter of providing information, it's a matter of understanding what's important to the person. For me, assertive communication is compassionate as it involves listening. If I tell you what I believe, then you might think I'm cold. If I listen first, then my answer is more honorable and correct. If a patient declines treatment, for instance, I should just restate what she or he already knows. I wonder why. Listen attentively and then explain the concern. Helps me to address the real needs rather than the visible behavior. This slide reflects collaboration is dependent and communications. Passive communication in a group can cause information to be lost. Being aggressive in communication can cause defensiveness. Assertive communication makes the team focus on the needs of the patients. For instance, if I'm using SPAR, I can clearly describe what's happening, my concern, and my action recommendations. This reduces team collaboration and makes it more organized and safer. Communicate assertively with limits is not giving success. A young employee might be able to think of what to say, but feel uncomfortable challenging an older employee. Also, it may be the patient has a fear or rage and misinterprets that message. Remembering the assertiveness must be tailored and situation in it is important. I would have to take into account variations in drama, voice and volume. If the sensitivity is not present, assertiveness can end up being ineffective or even increase tension. This is an example of assertiveness in action. Firstly, identify the patient's feeling, then I would make a statement about my professional concerns that was clear. Following this, I would ask the patient opinion. This helps to ensure that the patient has his or her right to participate in the care, but also fulfills my responsibility to communicate risk. It also demonstrates how assertiveness can work as an aid to de-escalation since the patient is not ignored, blamed, or controlled. My own experience is that assertive communication was something I will still continue to work on. I might be more assertive towards patients than towards senior professionals. There are a few things I would try to improve. One of them would be to practice SPAR and prepare some respectful phrase for discussing concerns. I would also look at my body language, since confidence is not only expressed in words. I'm not here to speak louder, but to communicate clearly, safely, and respectfully. As per the above presentation, I can conclude that assertive communication in the health and social care involves expressing needs, clinical judgments, and boundaries clearly and respectfully without compromising the rights of others. It is the optimal balance between passive and aggressive communication.